Good evening, viewers and friends out there. My name is Dr. Gidigbe Ogenekere, and you're welcome to another interesting episode of Lifeline on NTA2. Today, we'll be talking about dental care. Indeed, the teeth is a very important part of the face, and it subserves a lot of function. Apart from mastication or chewing of food, as we call it generally, it also subserves the very important function of cosmesis. Every now and then we say that girl has very beautiful set of teeth, or that guy has very beautiful set of teeth. But funny enough, is one of the most underrated, or I would say uncared for in terms of care. So it became very important that we'll talk of dental care just for the benefit of you, our viewers. Joining me in the studio today to talk about this all important topic is Dr. Oyakbero Afolabi, a senior registrar with the Department of Community Dentistry in Lagos State University Teaching Hospital, Ikeja. You're welcome to the program.
Thank you very much.
Dr. Afolabi.
Thank you very much.
Like I said, the teeth is a very important part of the face.
Yeah.
But it is the least cared for, if I should say, in terms of wanting to go to the dentist to check up your teeth. And that is why it became very important that we talk about dental care. Now, what is dental care? Is it just simply brushing your teeth morning and evening?
Well, thank you very much, Doctor, for your introduction. The first thing I want to say is that the mouth is actually the mirror of the body.
Okay.
Because everything that goes into the body passes it through the mouth. And talking about dentistry, dentistry is not just about the teeth, it's about the tongue, it's about the oral tissues, the cheek, the palate, and all the other structures in and around the mouth. And so you find out that a lot of diseases that take place in the body, like diabetes, hypertension, all those things have an effect on the oral cavity. For instance, we find out that people that are diabetic, patients that are diabetic, we find out that they tend to have gum problem. They tend to have bleeding gums. They tend to lose their teeth early. You know, so it goes beyond just the teeth. It goes to the talking about the whole other structures in the mouth. Now, talking about dental care, I would like to say that more than 400 bacteria or organisms have been isolated in the mouth of a living person, and quite a few of them are pathogenic, or what I mean that they are dangerous to us. And the basic things they cause, which many of us are familiar with, are tooth decay and gum disease. You know, and talking about dental care, the basic thing we want to do is to get rid of this bacteria as they form. The initial ones that form in the mouth on a daily basis, they are not very dangerous. But as we neglect the mouth, and as we allow more of them to form, we find them creating holes in the teeth and damaging the gums and supporting structures around the teeth. And so dental care, there is a role for the patient in dental care. There's a role for the health professional or the dentist in dental care. There's a role for the medical doctor, and there's a role for the community. Talking about the patient has a responsibility to clean his mouth on a daily basis. And of course, we all know that the easiest way to do that is to use the toothbrush. But brushing alone on its own, because some patients will tell you, oh, I brush twice a day. But there is a technique for brushing. There is a right technique for brushing. There is a right substance you apply on your toothpaste, or on your toothbrush, called the toothpaste, you know, that you use to brush. And there is a time to brush, you know, and when it is done properly, you find out that you are able to remove all the bacteria that can cause tooth decay and gum disease in your mouth. Beyond that, you also want to visit your health professional, the dentist. We normally advise at least, you know, once a year, but preferably twice a year. You pay a visit to the dental clinic twice a year. The dentist performs an oral examination. It looks at your teeth, looks at the gum, and tries to detect any form of problem that is developing there, and then it can give you an appropriate advice on what to do.
Okay, talking about visits to the dentist. A lot of us will be caught wanting if a panel were to be set up.
Yeah.
I, for one, have been wanting to visit the dentist for a while now, and I just procrastinate over and over. Now, I'm a medical doctor, but I'm not a dentist, and I might say that the mouth is not cared for. But how is the patient's current in terms of, do you get to see a lot of patients?
Yeah, we tend to see a lot of patients in the
Talking
dental
about
clinic.
the incidence of dental problems.
Yes, we tend to see a lot of patients, but unfortunately, you find out that almost 90% of the patients that come to the dental clinic, they come there because they're in pain.
Okay.
And that is actually a very wrong attitude. That is what we see in our environment. Is either they have toothache, or unfortunately some of them have maybe a tumor, a cancer, or a problem or the other that brings them to the dental clinic. But that is not supposed to be the right attitude. Patients are supposed to visit the dental clinic whether they have pain or not. For instance, tooth decay is a process that takes a period of months to years before it gets painful.
Okay.
The tooth starts getting soft, the enamel starts demineralizing, and then the decay goes into the dentin. When the decay is in the enamel, at that stage, you can actually revert it. When it enters into the dentin, you have to put a filling. But by the time it enters into the third layer of the tooth, which is called the dental pulp, at that stage, you have to do either a root canal treatment or you have to remove the tooth.
By dentin, you mean the root?
The dentin
tooth.
is the second layer of the tooth.
Okay.
And the pulp, which is the living part, the inner part of the tooth, by the time the decay gets there, most of the time, many of the patients end up losing their tooth. Okay. And so there is this perception that dentists remove teeth, but that is our least pleasurable activity. Okay. We don't enjoy removing people's teeth. We only remove it because they come very late. They present very late in the dental clinic. So if a decay is detected very early, it can actually be restored. Even there's some of it that you don't even have to restore. You don't have to put a filling. You can actually revert it either by giving some concentration of fluoride, applied on the tooth, and the decay process can be arrested.
Okay.
But when the patient presents late, you find out that at the age of 5, a patient has already removed some of the teeth. By the time some patients are 10, by the time they are 12, they have extracted 3 or 4 teeth.
So you see a couple of children, yeah?
Yeah, a lot of children. And also some parents actually believe that because baby teeth will eventually be removed,
yes,
I mean they will eventually be replaced with permanent teeth, that there is no reason for them to come to the dentist. Whereas those baby teeth, they serve a lot of function in the mouth and they are not supposed to be removed, except they are very bad.
Okay.
They are space maintainers for the permanent teeth.
Okay.
And by the time the patient actually loses those teeth early, you find out that the remaining teeth, they tend to drift. When it is time for the permanent teeth to come out, the space has closed and they tend to come out in the wrong position. And then in the layman's language, they say that that patient has scattered teeth. Mm-hmm. It's actually a problem that was created right from childhood. And these things can be prevented by visiting the dentist.
So viewers and friends out there, I hope you've been listening very well. You don't have to have toothache before you go to visit the dentist. The teeth or indeed the mouth is a very important part of the body and you must care for it. Like Dr. Folabi said, it is the mirror to the body. Everything that goes in most likely has to pass in through the mouth. Now talking about tooth decay, I'm sure our viewers out there will be very interested in wanting to know what are some of the risk factors to having this tooth decay.
Okay, we actually call it a triad of factors. The first one is the bacteria in the mouth. It forms in the mouth. Immediately you wake up, you feel some whitish stain on your teeth. We call it dental plaque.
Okay.
It's actually an accumulation of bacteria that forms in the mouth every day. And when you brush, you reduce the plaque and the bacteria inside it. The second factor is sugar in the causation of tooth decay. And sugar can be in the form of sweetened foods. It can be in the form of refined carbohydrates. It can be in the form of sweets. It can be in the form of biscuits. It can actually be in the form of rice. But the refined sugars are more dangerous than the normal natural sugars that you have in foods and vegetables. And then, of course, the third factor is time.
Sorry, when you say refined sugars, what do you mean?
I mean sweets,
You mean
chocolates,
sugars in chocolate?
confectionaries.
Yes, because they want to hear
chocolates,
that.
yeah. And when you have this in your mouth, what actually happens is that the bacteria in the mouth converts that sugar into acid. And that acid actually acts on the tooth and creates a hole in the tooth. That is what you call dental decay. And some laymen, they say that there are worms in my mouth. It's not actually worms that are there. It's actually the bacteria that is acting on the sugar, just like you have in the beer industry, where yeast converts sugar into alcohol. You know, you have the same process whereby bacteria converts sugar into acid
in the mouth.
In the mouth, yeah. And that acid actually dissolves the tooth. Now, some areas in the tooth are more susceptible to tooth decay, like the center of the tooth. We call it the pits and the fissures.
Okay.
You know, and then in between the teeth, you know, the spaces in between the teeth. You know, when we brush, the brush doesn't get in between the teeth, and so that place is very susceptible to tooth decay. And that is why we encourage that patients, they should floss. There's something we call the dental floss. In our environment, most of the patients, they tend to use toothpick to remove things in between their teeth, but we encourage them to use a dental floss.
The floss.
Yes. And that, apart from removing food fragments in between the teeth, it also removes the plaque that forms, the bacteria that forms in between the teeth, and prevents dental decay. So we have sugar, we have the susceptible tooth surface, we have bacteria, and then we have time. When I said time, I mean that when the sugar is in the mouth, you can actually clear it away.
Okay.
You know, by rinsing, by brushing, by reducing the amount of time that sugar stays on the tooth. The longer the sugar stays on the tooth, the more the possibility of it being converted to acid and then decay following on the tooth.
Okay. You have been talking about sugar. And I know some of our viewers will be saying, okay, I don't eat a lot of sugars, but I eat a lot of meat.
Yeah.
And after eating a lot of meat, I tend to have severe pain, as if my tooth is getting rotten. What is the role of proteins?
Well, I won't say that proteins have a direct role, but you know, when we talked about toothache, you know, I told you that we have dental caries, that is decay of the tooth.
Okay.
And then we have gum problem.
Okay.
You know, there's some patients that, because the gum is not appropriately cared for, that is, if you have the wrong technique of brushing, you don't brush properly, you use the wrong technique, you use toothpicks. Some people actually use pins to remove things in between their teeth. And all this allows bacteria to accumulate in between the teeth and leads to destruction of the gum and the supporting bone.
Okay.
We call that periodontal disease in dental terminology. So when this happens, patients tend to have gum problem, and that can actually lead to pain. But it's actually commoner in the elderly patients than in the younger patients. So we tend to have that more in the elderly patients, though it can happen in any age group.
Okay, you rightly said at the beginning of the program that dentistry is not all about the teeth.
Yeah.
And I know that there are very other important aspects of mouth care that you out there are worried about.
Yeah.
Something like halitosis, mouth odor.
Yeah.
What is the cause?
Well, we are very happy that a lot of patients are coming to the dental clinic now to, you know, volunteer information to the dentist about mouth odor.
Okay.
You know, we tend to differentiate halitosis from oral mouth odor. Oral mouth odor is actually mouth odor that comes directly from the mouth. But you know, there are other structures around the mouth that are linked to the mouth, like the, you know, the lungs, the stomach,
the nasal cavity,
the nasal cavity, and the sinuses.
Yes.
And so when you talk about halitosis, it can actually come from any of these. So when a patient comes to the dental clinic, we want to let the average patient know that mouth odor is not something you should be ashamed of. If you have it, please walk up to your dentist.
Okay.
And the commonest cause of mouth odor is a tooth decay, because you know bacteria are growing in there.
So we are coming back to tooth decay.
Yeah, we are coming back to tooth decay, but it's not the only cause. You know, gum disease also gives off mouth odor. Then the other thing is that a lot of patients don't pay attention to their tongue. You find out that a lot of bacteria form on the tongue, and it causes a kind of white coating. There is a coating on the tongue, and you know, the bacteria, they just have a field day there, and that can actually give rise to mouth odor. That is why we encourage patients that after brushing your teeth, brush your tongue. And most pharmacies now, they have what you call a tongue cleaner, or a tongue
Okay.
scraper that you can actually use to clean out your tongue. And there's so many other things that can lead to mouth odor. The food we eat, some people eat the raw garlic. You know, garlic is one of it, and there's some food that actually give off mouth odor in the patient. You know, oral infections. Some patients have, you know, diabetes. You know, they are predisposed to mouth odor. And then, like I said, you can have the general halitosis where somebody has gastric infection or he actually regurgitates. Patients that tend to regurgitate, they have, you know, mouth odor. You know, like I was saying, like you can see on the screen, I was trying to say that dentistry is not all about, you know, it's not all about the teeth. You can see people that have tumors of the jaw in the previous picture. You can see people that have, you know, excessive growth of the gum, missing teeth. These are things that can actually be fixed when you come into the clinic. There are some people that have these conditions. They don't actually know that there is anything that can be done about it. You know, you can see patients that have, you know, what we call malocclusion. The teeth are not properly arranged. And you can come to the clinic, you ask for orthodontic services. There are specialists that can do that.
Okay.
And they arrange the teeth for you, and they give you a pleasant, very pleasant appearance. You know, so talking about mouth odor, the patient should walk up to his dentist. You know, there are some tests we can do in the clinic. The commonest one we do is the organoleptic. We just move close to the patient and use our nose to perceive. You know, for some patients, they actually don't have mouth odor. You know, they just believe that they have mouth odor.
Okay, thank you, Dr. Folabi. We have to go on a short break now.
Okay.
When we come back, we'll be looking deeper into mouth odor, indeed the solution to this problem called mouth odor. Please don't go nowhere, have yourself there. Welcome back, viewers and friends out there. In case you're just joining us, you're tuned into Lifeline on NTA2, and we've been talking about dental care. With me in the studio has been Dr. Yakbero Afolabi, a senior registrar with the Department of Community Dentistry at the Lagos State University Teaching Hospital, Ikeja. Dr. Afolabi, before we went on the break, you were talking about mouth odor.
Yeah.
And I'm sure a lot of viewers out there want to know what are the possible solutions to mouth odor. Some say, I've brushed my mouth over and over. Some will even say, I've visited the dentist and they told me to use mouthwash, but nothing still happens. And indeed, this situation is quite an embarrassing situation, if you agree with me.
Yeah, it is.
So what are the possible solutions?
Yes, the first thing I would like to say is that at times even people that have mouth odor, even people that are close to them, find it difficult to tell them.
Okay.
And then we have a difficult set of patients that actually do not have mouth odor, but they believe that they have mouth odor, and it affects their relationship with their peers, their friends, and even their immediate family. So the first thing I will say is that please visit your dentist.
Okay.
Because some patients that don't have mouth odor, when an examination is carried out on them, we'll be able to tell them that, okay, this thing is in your mind, you don't actually have it, after we've carried out our tests. But for those that have it, we will actually examine them. Like I said, we start from common things. If there is a tooth decay, you know, if a tooth is extracted, and at times you actually have the privilege of looking at it, you actually find out that there is a decay that is offensive, you know.
Okay.
So the decay can be fixed. If there is gum problem, it can be fixed. And when we take a detailed history from the patient, we can actually find out that there are some things that that patient is eating, that is actually predisposing him to mouth odor. For some patients, you find out that they have gum disease, like I said, or they don't brush properly. When you don't brush properly, or you are using the wrong type of brush and it doesn't get to the crevices in the mouth, the bacteria accumulates there and gives off offensive odor.
So there's a wrong type of brush?
There is a wrong type of brush.
Okay.
There is a right type of brush. There is a manual brush, which is the one we are all used to. We also have electric brushes in the market that actually use battery. For people that actually find it difficult brushing properly, you can actually request for the electric toothbrush. It's all over the supermarkets in Lagos, But for the manual, it must have a right handle. The handle, you must be very comfortable. You must fit easily into your hand. The head, the size of the head of the brush must be appropriate to the mouth. That's why you find out there are some brushes that are for children, some are for adults.
Okay.
So the brush must fit very well into your mouth. So you can actually be brushing and your mouth may not be getting clean.
How long is it permitted for someone to use one toothbrush?
A toothbrush should actually be changed every 3 months.
Okay.
Or as soon as the bristles are frayed. At times not 3 months, but you find out that the bristles of the brush is bending and it's frayed. You should actually replace it. And then where you keep your brush is also important. Some people keep their brushes in the toilet, in the bathroom. It's actually wrong. You should leave your brush out of the bedroom. You should leave it an open, well-aerated place. The brush should stand upwards, and you should not cover the toothbrush, because when you do that, you allow bacteria to grow on the brush. So you're actually doing yourself a disservice. So that's why I'm trying to say that it goes beyond brushing.
Okay.
Are you using the right brush? Are you brushing the right way? Are you using, the right abrasives and the things you are using as toothpaste? Does it contain fluoride and things like that? So talking about mouth odor, please pay your dentist a visit. Let him carry out a thorough examination.
Okay.
And like I said, for some people, it's not actually coming from the mouth. So if you have halitosis that is not coming from the mouth, and you are using all the types of mouthwashes available in the market, you find out that you're not getting better, because there's actually a medical condition that needs to be fixed before you take care.
Most likely
of that
something
problem.
with the ear, nose, and throat.
Yes,
yeah?
with the ear, nose, and throat. Yeah.
Okay. Before I go on to my next question, you've been talking about toothbrush, but we know that there are some people in Nigeria today that are used to chewing stick.
Yeah.
It doesn't mean that those who use chewing stick will regularly come down with these mouth conditions.
No, that is actually a very good question. We believe that there is nothing wrong with chewing stick, because a lot of studies have been carried out, and they found out that you can actually get very good mouth oral hygiene with chewing stick.
Okay.
But unfortunately, a lot of patients, they chew the chewing stick and they spit out rather than using it to brush. What you're supposed to do is to actually get the appropriate type of chewing stick, and you chew the tip to make it to create bristle forms on the toothpick, on the chewing stick, and then use it systematically the way you will use a toothbrush. The toothbrush is easier to use.
Okay.
You understand what I'm saying? And it is effective. But if you are used to the chewing stick, you have to use it appropriately. If you are using your chewing stick appropriately, you will actually get good results and you will not have dental problems, as long as you are using it appropriately and you're not just chewing it and spitting out. So if it is properly used, you get the right
Okay,
results.
before we go, you talked about oral cancers, and we saw some pictures on screen of someone with a tumor. Well, before now, I didn't believe that you get to see a lot of cases of oral cancers. How common is it?
It is quite common. Well, in a country like Nigeria, I will say that the prevalence is not as high as in some countries like India, where they have a very high prevalence of oral cancer.
Okay.
But we actually have a lot of cases. But let me also say that some of them are not cancer. Some of them are benign.
Just tumors.
But they disfigure the patients. And it's very unfortunate when you see some of these patients on the road in the median, where some people are using them as beggars to beg, and you see that big tumor on their face or on their jaw. They're actually resectable. And after they have been removed, you can actually reconstruct. So these are done in the teaching hospitals in Lagos here, and they're properly done. And it's actually the work of the dentist. That is the maxillofacial surgeon, who is a dental specialist.
Okay, our time is fast spent. This topic is indeed a large topic. It is not something that we can complete in one episode of the program. But viewers out there, if I haven't learned anything at all today, I have learned that I should visit my dentist at least twice a year. Not only when I have issues with my mouth, but to prevent issues from occurring in my mouth. Please join us same time next week for another interesting episode of Lifeline. Thank you for coming to the program.
Thank you very much.